Well, we might touch on the freight hub first. How important do you think it is going to be in terms of getting our produce to those key markets?
This is an incredible opportunity for us to really supercharge our export of Queensland agriculture, in particular Queensland produce, into Asia, and having this refrigerated space will allow our producers to keep their goods in the best possible conditions, ready to be exported. So, Queensland beef, Queensland dairy, all of those products that we're renowned for will be able to go from right here at Wellcamp right into Asia. Did you want to add to that, John?
The produce not only goes to Asia, we send produce from here to all parts of the world. It's absolutely incredible what goes on these freighters. And we get things from seafood, North Queensland, mangoes from Bowen, produce from the Northern Territory comes into here, but also from all around Queensland. And as I said before, with Inland Rail coming through, we think that we can really open this region up to the whole of Eastern Australia and get produce, particularly produce, up to Asia very efficiently.
Obviously we're already able to export, John. What added benefit is this going to have?
What it means is we'll have much more cold chain capability. So with chiller and freezer, and pharmaceuticals, we can handle all those products. And our existing freight shed is sort of 700 metres. This is 5 times the size of it. And we've already got people from all around the country wanting to relocate their facilities to Toowoomba and move in with us here to get that advantage.
Obviously this isn't the only big project you've got on the cards for Wellcamp. You've put forward this plan for the COVID camps here. Is it an opportunity to discuss with the ministers today?
But we don't refer it as COVID camps. It's a quarantine accommodation facility, and the model that we've adopted is what has happened at Howard Springs in the Northern Territory, and that facility is the only facility that hasn't had a community outbreak. And what we've proposed to the state government and then on to the federal government through the state is that we will build it, maintain it, do the food and beverage. Queensland Health will be involved in how the health side of things works, and every room will have its own air conditioner system. There will be no corridors for airborne particles to be transmitted. And I see now Lindsay Fox at Avalon Airports, he's thought of the same thing yesterday, and he's looking at doing that in Victoria. So obviously they've had a look at it, and it would appear that it's got a lot of merit.
How quickly did something like that be constructed?
We'd get the first 400 to 500 rooms up in 6 weeks from signing an agreement with the government, and have the total complex finished in 12 to 14 weeks.
And how many people could it accommodate?
The proposal we've put up is for 1,000 repatriated travellers and 300 staff.
And how much would it cost to build and run?
Well, that's commercial in confidence because we do everything at cost here at Wagner's, and it would create about between 350 and 400 construction jobs to get it up and running.
John, where have those discussions got to now?
They're between the state and the federal government, so maybe you could ask the Deputy Premier to comment on that.
What response have you had from the governments?
It's been pretty positive, I think, but there's a lot of detail to go through, so it's still in the, let's say the feasibility stage, and if it stacks up financially, then it will go into a lot more detail, particularly around Queensland Health, how people are treated, how they're transported, standard operating procedures for the facility. So I think there's a lot more detail to be worked out and a lot more community consultation to be done.
Are you feeling fairly optimistic about it? How are you feeling about its chances?
I don't get optimistic about too much at all, actually, so wait until we've done a deal.
You mentioned Lindsay Fox had a similar proposal to yours. What do you make of it?
I think it's the lights have come on down in Victoria, and they've got a major issue there, and he thinks he can help the Victorian government like we think we can help the Queensland government.
Why do you think it's necessary when the containment's been pretty good in Queensland?
Because I think this quarantine thing is going to go on for quite some time. And the other thing I didn't mention is that every worker at this facility will be vaccinated. Otherwise, they won't be able to come on site. So the risk of community transmission with the vaccination being rolled out is extremely low. And clearly what has happened in hotel quarantine, particularly in Melbourne, has been, a disaster. Whereas the Queensland government have done a very good job at trying to contain it.
DP, can we ask you some questions?
So the big risk with the hotels has been workers going back out into the community. I understand under this proposal they'd be working and living here, or they'd be able to stay. Does that mean they just have to stay at the site permanently, or isn't there a risk they would go out into the Toowoomba community and infect people there? Is the risk still there?
Well, I'll let John talk to the staffing model, but the two big advantages of a purpose-built facility are, first of all, that you can properly ventilate the spaces around the accommodation, so you don't have the hallway or corridor effect that we've seen in the recent outbreaks in hotel quarantine, and also the ability to have a secure, stable, full-time workforce. Some of them could stay on site, and that would obviously further reduce the risk, but just allowing people to work full-time in the one location also reduces the risk. If you think about hotel workforces and hospitality workforces, many of them work 2-3 jobs, or have partners and family members working multiple jobs with lots of contact with the public, and so that concentration of workforce is also an opportunity here.
The state government's working as a bit of a mediator between the Wagners and the federal government. What sort of conversations has the state been having with the federal government?
That's right. The ball is largely in the federal government's court now. We've put forward a lot of information, we've answered a lot of questions, and now it's really up to the federal government to decide whether they will act to keep communities safe.
The Prime Minister needed more details on that proposal. Have they been supplied?
So more details were supplied Friday, yes.
There's also been a concern that if COVID was to get out, it would place a big burden on what is a regional healthcare facility here. How would Queensland Health handle that?
Well, first of all, the entire Queensland Health system would be there to support Darling Downs Health with whatever health needs were both here on the site and in the case where there were COVID positive cases, and so there would be additional resources available. But let me just also say, as a former health minister, and the Treasurer is also a former health minister, Darling Downs Health Service is one of the best in the state, certainly the best of our regional health services, and so their ability to support this facility is really strong, and they proved that early on when there were cases out here.
So when will there be community consultation?
Well, this would be a national quarantine facility run by the federal government, so you'd need to ask them how they intend to engage with the community on that. We've put forward this as a proposal to avoid having to shut down whole cities for 4 or 5 days like we've seen in Perth and Brisbane and Melbourne. And Scott Morrison really needs to consider how many times he wants to see that happen before we put in place a more effective quarantine regime that's able to deal with this new, more infectious strains, these new, more infectious strains.
How much would the state government be prepared to spend?
So the intention here is for it to be funded just like our hotel quarantine is by returning visitors paying their contributions.
No, but the construction of the actual facility?
The details of much of that, as John said, are commercial in confidence, but the intention of our hotel quarantine program is that it's funded by returning travellers.
But how much would the government propose to spend? How much would you be prepared to spend?
Just answer that.
Yeah.
Self-funded.
Firstly, I'd like just to talk about a few things. One is the funding. We are not asking any level of government for any funding for this project. The way it works is there's a published rate on the Queensland Health website, so anyone can go on that and have a look, and that's what the returning travellers pay, and that's what we would be charging the state government, who would on-charge it to the federal government, I assume. We'll be charging someone that, but it's a user-pays facility, so it's self-funding. There is no money coming from the state or federal governments. On the workers, the intention is, and this is the detail to be worked out in the next stage, is that the workers would look at probably a 2-on, 2-off roster. So when they're at the facility, they stay at the facility like they do in a mining camp or anywhere else. They don't go home into the community of the night time. They get recompensed properly for it, and that's one of the issues with hotel quarantine, is these people have to have 2 or 3 jobs to be able to survive. And if you looked at what's just recently happened in Melbourne, where the lady who was the cleaner then went and worked in the airport cafe, and we had 1,500 people from Queensland go through that terminal, go through that cafe, up into Queensland. So we think that the solution that Howard Springs has put forward and works well, and if we adopt that same model, then it should be very low risk.
So we just had one for the here. Obviously Toowoomba hasn't been listed as a vaccine hub at that city state. Would that change if we were to become a intake for returning travellers?
That initial plan relates to just the phase 1A of the vaccine rollout. Clearly we would be foreseeing that the subsequent phases, which will come online very soon, would include Toowoomba and Darling Downs, yes.
The Premier's previously said that a facility like this would need to be staffed by the federal government. Is that something you still agree with?
Well, clearly what we need is for the federal government to take more responsibility here, and that would include playing a greater role in the operating of the facility, yes. If you think about how we ended up with hotel quarantine, around this time last year, the Commonwealth weren't willing to take responsibility for quarantine, which is traditionally their responsibility, and so the state stepped in and implemented the hotel quarantine regime. And Scott Morrison's right when he says we've done a very good job of it, but the virus now is changing and hotel quarantine is becoming less suitable, less safe, and that's why we are calling on them to take more responsibility now than they did last year and assist us in delivering a national quarantine facility.
So would you see that being staffed or policed instead of Queensland Police? It would be by the Defence Force?
Oh, look, there are obviously different options for how we staff and different kinds of staff too. There's hospitality staff, health staff, security staff, and so we'd be able to work between Commonwealth government agencies, state government agencies and the Wagners to determine who did what and what the model there was. We're obviously keen to still be involved, but what we need here is more support from the Commonwealth government. Clearly, a national quarantine facility shouldn't be the responsibility solely of a state.
Would you like to see more people return back, Queenslanders return back if there's something like this established?
Well, there are tens of thousands of Australians currently stranded overseas who want to get home to their family and their friends and their home country, and we want to support them to do that while also keeping the rest of our community safe. That's what hotel quarantine has been about all along, but our hotels aren't built to be quarantine facilities, and we're seeing that now. A purpose-built facility would allow us to allow more Queenslanders to come home.
Minister, I just had one question for you from Cairns, if that's okay. I just want to know if you have any update on the Cairns freight facility at this stage.
That's like both of the trade export facilities, both here in Toowoomba and in Cairns. It's the proponent who is driving the delivery of that. So we, of course, will be working with the consortium. There was a consortium that came together in Cairns to develop that facility, and we're keen to see that be developed as quickly as possible. Clearly there's some challenges in Cairns separate to what we see here in Toowoomba, so we're happy to get you an update on where that's at, but it's important for our exporters, whether it be pork producers from the South Burnett, horticultural producers from the Lockyer Valley, cattle graziers from the Western Downs, that they get an opportunity to get the world's best produce that we produce in Queensland to market internationally. And we know there's going to be a growing demand for Queensland produce, and so we want to help in the far north as well, but they've got some challenges at the moment, which a sophisticated quarantine program could help address going forward.
John, sorry, just one more. I know you've touched on this, but when the quarantine facility is no longer needed, where would you see it shifted to and for what purpose?
The intention is when it's no longer needed, it would be disassembled and shifted to other places around the country, whether it be mining camps or something else. We're not sure. That detail is still yet to be worked out. But one thing we can say is that when the facility is finished, it is the intention to disassemble it.
Minister Miles, can I get you back up just for one question?
Sure.
Thanks. Minister Miles.